welcome to the Social Service Workforce webinar series brought to you by the Global Social Service Workforce Alliance through funding by PEPFAR, USAID, and supported by CapacityPlus. My name is Dykki. I'm the Director of Health Workforce Informatics for CapacityPlus and IntraHealth International, and I am proud to support the open source iHRIS Health Workforce Information Systems, and now becoming the Social Service Workforce Information Systems, as well as all of the associated applications of technology and use of data for the workforce. And we usually begin, and this slide you're going to see once more during the Tanzania presentation, but this slide reflects the importance of good workforce data for supporting any workforce. This includes training. I'm not sure how to drive the slides. There we go, I see it now. Education and training to make good decisions about the quantity and type of training needed for workforce professionals. Registration to ensure qualified supply. Deployment to meet needs. Management of personnel, including tracking movements and particularly for addressing rural versus urban issues. And planning, ensuring the right person with the right place with the right skills is the right time to provide necessary services. Now, as I mentioned, we have in CapacityPlus been using technologies to support the health workforce and the many stakeholders across the health workforce. And so we've been using the technology, the iHRIS open source health workforce information system software, to address some of the roles and goals that are being supported in the health workforce. These include health service delivery for managers, iHRIS Qualify for health professional regulation, iHRIS Plan for workforce planning and modeling, iHRIS Retain for planning and costing retention interventions. There we go. Let me just step back. And so that's management for management and managing deployment of health workers, iHRIS Qualify for health professional councils, iHRIS Plan for workforce planning and modeling, iHRIS Retain for planning and costing retention interventions, and most recently, iHRIS Train for tracking pre-service and in-service training. All right, so these software were designed for the health workforce, but as the system has been deployed and working across a number of countries, we've begun to see it adapting into different contexts. This software is supported by an open source community of 150 active participants. In the 1 year since the community was launched, we've seen about 300 issues raised, addressed, and resolved in about a year of operation. The software is supported by 6 donors, the primary donor being USAID, and 7 implementers, primary implementer being IntraHealth. All of these donors and implementers have been engaged in supporting software implementation in 1 or more countries. And altogether, this community is supporting the iHRIS software in over 1,100,000 workforce records across 19 countries. Now in this map you'll see 3 colors. The red are supported by the USAID-funded Global CapacityPlus project. The blue countries are supported by other USAID projects. And the green countries have independently downloaded, adapted, and deployed the software or are working with other donors and programs to get implementation support. So in some detail, you can see all of the countries here, the projects or donors that support them, as well as the number of workers that are supported in the system. For the vast majority of these are being supported by or represent the health workforce, for a total of 1,110,495 records at our most recent count. Now, I want to draw your attention in this. To this asterisk on Tanzania, where it's noted that 298,992 of the total are not health workers. In fact, that is only 15% are health workers, and the vast majority are other employees being supported by the local government. And so this is going to take us into exploring how this software that was originally designed for the health workforce has been adapted for other workforce cadres, including the social service workforce, the point of our workshop today. I want to take a minute here and talk about costs around free and open source software. The mantra is typically that free software is free as in speech, not free as in cookies. I think the Latin languages have it a little bit easier with terms like libre and gratuit, which works just a little better than free and free. There are indeed costs in deploying free and open source software. Those costs are involved in building local developer and implementer and support capacity, adapting the software to local needs, and training users and decision makers. But those are good places to put resources for local ownership and sustainability. The amount that can go into Silicon Valley licenses for proprietary, that is to say non-free and open source software, can be quite prodigious. Leading corporate HRIS can cost up to $185 per person and more than $40 each year for licensing and support. With the iHRIS software being free and community supported, these more than 1 million records would cost over $200 million US to support, to purchase the software initially, and then require more than 45 million more each additional year. So by spending much less money than that, you can build the local capacity, infrastructure, and systems as a much better investment for the country and support these systems. Too many stories abound of countries entering large contracts with corporate software vendors and not being able to afford them. So after thinking about this, noting these expanded workforce within Tanzania, I want to focus in a little on what Tanzania has done. They took the software and instead of focusing on health worker cadres issues and management capabilities, they took it and supported the local government ministry to really support all of the local government workers, and took special interest in a particular cadre of the social welfare workforce, the parasocial workers. And you'll hear today how the Tanzania iHRIS team adapted the software to provide an essential understanding of this crucial cadre. Another innovation that Tanzania provided was the iHRIS Academy. And the University of Dar es Salaam team, some of whom you will be meeting today during their presentation, pioneered this academy. In 2012, it was quite Tanzania-focused, supporting a large number of stakeholders working with iHRIS in the country. In 2013, more than 9 countries attended, including a large delegation from the Malawi Ministry of Gender, Children, and Social Welfare. The Tanzania parasocial worker system that had been adapted by the team was presented to the Malawi delegation and the rest of the attendees at the iHRIS Academy. And they were able to then validate and see the opportunities to contribute to the work they had already begun in adapting iHRIS to support the entire social welfare workforce cadre in Malawi. And after Tanzania presents their work with parasocial workers, you'll hear how Malawi is moving to the next step in using iHRIS to support the complete public sector social welfare workforce in Malawi. So with that, let me move on to the agenda. And I want to do a few introductions of the Tanzania team, and I'll introduce the Malawi team after the Tanzania team is done presenting their activities. Then the first person I would like to introduce is Evelyn Kamote, the Principal Social Welfare Officer for the Department of Social Welfare. Ms. Kamote is the Principal Social Welfare Officer and working there since 1978 at the Department of Social Welfare at the Tanzania Ministry of Health and Social Welfare. She started working in several offices within the Dar es Salaam region, then transferred to the head office of the department in 1984. Since then, she's been working as the head of the Early Childhood Unit with the main task of coordinating activities related to development of guidelines, standards, curriculum, policies, training materials, and advocacy. Evelyn is also coordinating other activities related to the program of care, support, and protection of MVC, most vulnerable children, such as the development and dissemination of the National Guidelines of Quality Improvement for MVC, and the development and implementation of the Social Welfare Workforce Strategy. Evelyn is a national facilitator in quality improvement, identification on the most vulnerable children, caretaking skills, early childhood development, child protection, and also a trainer in all these areas. She's also a trainer of social welfare certificate course undertaken at Kisangara Social Welfare Training Institute. Our next speaker, Norah Kaaya, worked with IntraHealth International from 2011 to 2013 as monitoring and evaluation specialist for the parasocial worker program of the Tanzania Human Resources Project, funded by the USAID mission in Tanzania. She holds a Master's of Arts in Sociology from the University of Dar es Salaam, majoring in Health and Population. Currently, she is a consultant with NIRAS, NIRAS Tanzania in the evaluation of civil society organizations being funded by Norway. Our next speaker, Rehema Kombe, Senior Social Welfare Officer, is of the Department of Social Welfare at the Ministry of Health and Social Welfare in Tanzania, is a holder of a Bachelor of Arts in Sociology and a student of the Master's of Arts in Social Work at the Open University of Tanzania. She's a Social Welfare Officer 1 employed by the Ministry of Health and Social Welfare, working in the Department of Social Welfare since 2008. She started working at Tabora Regional Office as a Social Welfare Officer 2, later as Acting Regional Social Welfare Officer, with the role of implementing and overseeing all social welfare issues in the region. Later in year 2010, she was transferred to the department's headquarters, where she is currently working in a unit of child protection and child welfare related to development of guidelines, policies, training materials, as well as monitoring and supervision of social welfare activities, also providing technical support at the national level. She's also a focal person in the department's data management information system, responsible for the most vulnerable children's data management, child protection information system, and the social welfare workforce. She's a national facilitator for child protection management information system, and psychosocial care and support. Our next presenter, Hilal Seif, Senior Systems Administrator for the University of Dar es Salaam in Tanzania. He is actively involved in the software customization of both the local government human resources information system and the parasocial workers tracking system. Both systems are based on the open source iHRIS software. One person who has joined us today who is not on the agenda is Dr. Juma Lungo. With a bachelor's degree in computer science from the University of Dar es Salaam and a master's and PhD in information systems from the University of Oslo, Norway, Dr. Juma Lungo has been a lecturer at the University of Dar es Salaam since 2003, managing director of Zalongwa Technologies Limited since 2006, and deputy director of the University of Dar es Salaam's Center for Virtual Learning since 2011. Dr. Lungo led the HRIS support to the government of Tanzania from the University of Dar es Salaam during the Tanzania Human Resources Project from 2009 to 2013, and continues to provide regional leadership of the iHRIS open source technologies through the iHRIS academies and support to other countries in implementing HRIS, including Sierra Leone and Malawi. Next on our list, Bakari has been with IntraHealth since 2009 as a Human Resource Information Systems Specialist, managing the HRIS implementation in the Tanzania Human Resource Capacity Project, which ended last year. He's currently with IntraHealth Tanzania as an HRIS consultant and holds an MBA from the University of Dar es Salaam, Tanzania, and a Master's of Public Health from UNC Chapel Hill. That rounds out our large and excellent team from Tanzania. We'll be presenting on the parasocial welfare system. I'd also like to introduce Jim McCaffrey of CapacityPlus. He's a senior technical advisor with deep experience in capacity building and system strengthening. Over the past 10 years, he has specialized in leading and managing health and social service workforce strengthening initiatives. He's currently the chair of the steering committee for the Global Social Service Workforce Alliance and has participated in all of the Alliance workforce webinars. And Jim will be providing Q&A moderation after both the Tanzania presentation and the Malawi presentation to follow. And so with that, I would like to hand, oh, not quite yet. I believe we have one more slide. Just a reminder that the way we're going to want to handle the questions is for folks to write their questions into the question box. And the team will be noting your questions and be moderating and responding to them during Jim's follow-on to the Tanzania presentation. And so with that, I would like to turn the mic over to the team in Tanzania who will be presenting the work with the iHRIS software to support the parasocial welfare workforce in Tanzania.
All right, if our next speaker could just remember to click on the microphone button so that it's solid green, and then continue with your presentation. Thank you. So if the connection that Evelyn is using could go ahead and click on that microphone button and get started, please. Thank you. Or type in the chat if you can let me know if there's an issue that you're experiencing, and we'll work with you on it.
So we're not hearing anything from the Tanzania side. I'm going to give it one more minute to get connected, and then if we are not able to get them connected, we can begin with Malawi as an alternative. Kaaya or Evelyn, are you able to click on your microphone button in the upper left-hand corner?
Can you hear us now? Hello? Okay. Yeah.
Okay. Good morning to everyone, the participants and organizers. I'm Evelyn from Tanzania, a Principal Social Welfare Officer. I'm going to run you through our topic, and in the middle I'll hand over to Rehema Kombe. Our title is about using human resource information systems to improve the social service provision. So we are going to share our experience on how we did in Tanzania. The next slide is just highlighting the acronyms. So I'm going to system, and also about how we establish the link between the parasocial workers program and the most vulnerable children program as the area whereby we were looking for the workforce for supporting sex provision to the most vulnerable children. And again, we will share with you how we partner in the data tracking system. And also, we are going to share with you about the experience in installing the system, and also about parasocial worker system highlights and how the parasocial worker system is functioning. So that is about our outline of the topic. As regards to the background information, we are saying that we started the parasocial workers program or system in order to have the following: that we were lacking in Tanzania a reliable data system to track the social welfare workforce. But again, we were lacking a social welfare workforce at the community level, whereby most of the most vulnerable children and the other social service delivery systems are being needed by the community members. And again, we started our data system on tracking the social welfare workforce because we were in the need of having a reliable data, which is crucial for predicting issues related to recruitment and deployment, and tracking where are the social welfare workforce. And again, we were on the need of having a cadre at the community level, which we assisted the provision of social welfare services regarding the service provision to the most vulnerable children. And we are continuing with the background information that the parasocial human resource information system was introduced in Tanzania in the year 2013 through the partnership of Department of Social Welfare in order to facilitate the ownership of the parasocial information system. At the national level, the Department of Social Welfare is the department which is mandated to coordinate the social welfare service provision. So since we are coordinating the services, again you are the ones whom we are supposed to coordinate the issues related to human resource for social welfare workforce. And also we were envisioning that to have the human resource information system, it will provide us with a technicality results to fill the gap of worker specific information needed at the local level. And again, we thought that by using the parasocial human resource information system, we will be in a position, we will use it as a useful tool for tracking the parasocial workers. So, going to how we link the parasocial worker program with the most vulnerable children program, we are saying that the purpose of establishing the parasocial workers system is in order to strengthen local government systems to provide basic social welfare services to the most vulnerable children through the development and support of the parasocial workers and their supervisors. At the local level, we train both the parasocial workers and the senior officers within the local level and the district level as supervisors in order to have a clear mark on what the parasocial workers doing at the community level and providing the technical support. And in terms of our program components, we have several. One is related to partnership and advocacy. This is related to building a coalition and also ownership within the government. That is, we have partners who provide technical support to the government, but we have to build a coalition so that we work together within the system. And again, another component is about strengthening local government infrastructure in terms of human resource for improving social welfare service provision at the local level. And also, another area of the program is related to human resource and training, that if we have a system where we track the workforce, it is easier for us to plan and to build the capacity for those who are providing services in order to have a quality service provision. And there are issues related to service delivery, monitoring, and evaluation, because in any program which is established, we have to have a system of how we are providing the services and how we monitor and how we do evaluation. And continue with the relationship, the link between the parasocial workers system or program vis-a-vis the most vulnerable program in the country. That our partnership, as I have mentioned earlier, that we have a technical support from the Institute of Social Work and the Adams College of Social Work, and again we have the International Health Alliance, who also is partnering with the government. And in terms of technical support, these partners supported us in the development of the curriculum, and we review any other training materials in order to suit the training programs to the parasocial workers. And also at the national level, the Department of Social Welfare is under the Ministry of Health and Social Welfare, which is mandated to develop policies, guidelines like the curriculum of the parasocial workers, and also we have PMORAG. as a ministry which is overseeing the service provision in the local government authorities. So all the partners work together to establish and to institute the parasocial workers program, and again to come to a place where we came to an agreement that we needed to have the parasocial workers tracking system. In terms of scaling up the parasocial workers program, we again partner with our other partners in scaling up the program to the local government authorities. For example, we have Pakti Tanzania, whereby we done the training to the parasocial workers in the southern part of the country, and also we have Africa, who is working in Dodoma in the supporting the most vulnerable children in that region, and we again partner with Africa in establishing the parasocial workers in that area so that they support in the service provision. And also we have UNICEF as our partner who is supporting the government in establishing child protection system, and parasocial workers are part and parcel of the members of the child protection team in the local government authority. So we have a number of partners who are making use of the parasocial workers in terms of improving the service provision. As regard to the system adaptation, we are saying that the parasocial worker system has been already customized in the IntraHealth Human Resource Information System, and we are envisioning to have the following: that after managing adapting the parasocial workers tracking system, we are envisioning to include all the social welfare workforce, because in Tanzania we are starting with the social welfare officers, and we have the cadre, which is the social welfare assistant at the community level. So we start with the parasocial workers, the social welfare assistant, and the social welfare officers. So we are thinking to improve that data, that tracking system in order to include all the social welfare workforce in the parasocial workers tracking system, so that we will be in a position to make a case that we have how many social welfare officers, where are they, what are they doing in terms of tracking the social welfare workforce. And again, we are saying that we have already started to customize the social welfare tracking system by making use of it. Already produced some of the reports, and also the social welfare tracking system is used in issues related to budgeting and planning information. And also we have the parasocial worker system now used by the Department of Social Welfare to inform about the parasocial workers program in terms of planning, implementation, and monitoring. Coming to the process of designing the parasocial workers tracking system, we started by conducting an assessment in order to establish the needs and how to manage the institutionalization of the tracking system. And we go to a step of implementing the system by developing the software, and in so doing, we get a consultant from the University of Dar es Salaam who supported us in terms of technical support in designing the system and how the system is going to be customized and be used by the service providers in the ministries and the local level. And also the issue of data entry and issues related to quality. Those are areas which have been taken into account in developing the data management system, that in terms of data, we have to collect and make entry update the data so that we have the updated data. And again, in the process, we thought about issues related to sustainability. That, as I have mentioned earlier, that we have partnerships, so we have to make use of our partners, and we have to support issues related to network, centralization of the data to the Department of Social Welfare. And having this tracking system, it will assist us in reducing some of the costs of tracking issues related to the social welfare workforce. Because as far as the department is aware of what is on the ground, it will be easier for resource mobilization and the planning, and also it will be easier for employment and the deployment of the social welfare workforce. We are saying that good parasocial workers data system is needed for the following. This is just a summary of what I have already mentioned, that it is a very important tracking tool for us because it will assist us in issues related to planning, training. In the area of education and training, we are saying that it will assist us in planning and training of the parasocial workers, and since we are visioning to include all the social welfare workforce, we will be in a position to have a good planning in terms of training and education of the social welfare workforce. And again, there is the issue of registration, whereby we are going to have a data which is showing us where are the social welfare assistants, where are the social welfare officers, as well as the parasocial workers, and issues related to employment and deployment, and how to manage the personnel. And again, issues related to planning, that having the good data, all these components have been taken care in the parasocial workers tracking system. This figure here is showing how important the parasocial worker is in the human resource information system within the Ministry of Health and Social Welfare and the PMORAD. That since it is a cadre which is starting at the lower level, so without that parasocial workers data, it means that we are missing something in the human resource information management system within these two ministries. And currently, these parasocial workers, by using this system, we were able to track them, convincing them to join the social welfare training assistant course. So now they are taking their course in some of the institutions which is providing social working training. So we are saying that, so to start with at the lower level, we have to start with the parasocial workers as the lower cadre, then we come up to the social welfare assistant, then to the social welfare officers. So having given you the overview of how we came up about to the data or to the tracking system of the parasocial workers, now we are coming to how the data is functioning. So on this area, I welcome Rehema Kombe, who is our data specialist within the Department of Social Welfare, to run you through how the parasocial workers tracking system and how we manage it within the Department of Social Welfare. So I welcome Rehema Kombe to take you through. Welcome.
Thank you very much, Madam Kamote. My name is Rehema Kombe. I am a social welfare officer from the Department of Social Welfare. I will proceed where my colleague just ended. As you can see, the functionality and data use examples. The first page is login, whereby you have to log in with the password and username. You can see also there is add or update tracking tool data, whereby it's the feed where you fill the biodata or information about a social worker or parasocial worker or assistant social welfare officer. as she mentioned. So it's a field where you can recent changes, can put changes, can add or update any information that you already have in the system. You can see also the next page is whereby you can be able to view the report. You can view and print the report about the information that it depends on what kind of information you want. If you want to view the report about parasocial workers, you can go to select what region or district or any level that you want and see the report. So you customize according to the variable that you want to see. You can see where the configure system, but also set records. So you can view and print different reports according to what information that you want to view. Now coming to the parasocial highlights. First, it is a web-based, and the website is http://www.psw.or.tz. that you have to log in to that one first, then you put your user name and ID or password. We are saying it's a tool for tracking parasocial workers, social welfare officers, and social welfare assistants. As my colleague said, you can also get the information or biodata. Also, it's a tool used by local government authorities for budgeting, planning, and decision making. And currently, the system is having 3,786 parasocial workers to date. But we expect to have other social welfare workforce. At this stage, we expect to have social welfare officers and social welfare assistants. But now the database is currently having only information about parasocial workers. But also, the Department of Social Welfare is being already introduced to the system. They are aware of this system, and that's why they suggest to have social welfare workforce database instead of having just parasocial worker database. It can also use to improve data access and use at the Department of Social Welfare and other levels. As you saw, the Prime Minister's office can also use this data and can inform different decisions. Previously, we had or we depended on Excel sheets to keep this information, but now we are having this database, which is easy to access, and can also inform planning, as I said, planning for decision making. There are also challenges that we are thinking how to adapt, like data quality from the district to the region and other areas. This has always been a challenge of how we ensure that we have quality data, but also information communication technology capacity and support, and how we ensure that we have well-trained staff and who can manage the database. But also we have this challenge of having multiple systems at the needs of health and social welfare, Prime Minister's office, and also President's office. They are having multiple databases. We are thinking of how to merge, how to interlink, so that the system can be speaking to each other. We also think of insufficient information communication technology infrastructure, like computers, to ensure that we have enough computers and other infrastructures. And what are the next steps that we are planning? To train and support sustainability at the Department of Social Welfare. That will be very important, and stage the challenge of having qualified people who are well trained in database. So this is one of the next steps, that people have to be trained and supported at a department level and the other levels which are going to use the system. But also scale data collection and use to district or regional level. because the data has to be used from district and region and national level. So we are planning to scale this collection of data to a district, region, and the other levels. Also to share data or information with the stakeholders for informed decision. This is very important that we all, as stakeholders, to have one and common understanding of the information gathered. Also, a strong country team that is using a larger global human resource information system community. Also, to focus on data quality, data use and analysis. This is very important. And as I said earlier, to link this information system and the other efforts. Also to document and communication strategy. You have to document so that to be able to share. And also to enter data of other social welfare workforce. As we said, we only have information about parasocial workers, but we're not thinking or planning to ensure we have the information about other workforce. Thank you very much, and this is the end of our presentation. You're welcome for question, clarification.
Thank you very much. Can you hear me? Is my microphone being clear enough? Yes. Terrific. Okay, so we're going to have an opportunity. I'm Jim McCaffrey, and we're going to have an opportunity to have some questions to the Tanzania team about their presentation. And thanks very much to the team. That was very clear and informative. And so we'll take 10 or 15 minutes now for these questions. And then we will go on to Dykki, who will introduce the Malawi team, and then to Malawi, and then have questions then, and then at the end we can ask some more general questions. So we'll take time now to do that. So there have been a couple of questions, and if you have questions, if you can write them in the chat window, then we'll try to pick them up. We may not get to all of them, but we have some ways to continue working after the webinar is over. So the first question came from, I think, Elaine Baker, and she had several, but one was, how many local government authorities are using or making use of the system as it is now? So I will ask that, and maybe one of the Tanzania team members could answer that. How many are using it now? Go ahead. Somebody.
Anyone who wants to say?
Go ahead.
Bakari, we can't hear you.
Well, I'm gonna take it. Replay. Hello. I'm going to take it, and with my experts around here, if there's anything they'll add on it. So far, the system has just been introduced last year, and it's centrally at the Directorate of Social Work. So far, what has been done is sort of initial setup, and the plan, as it appeared in the next step, is to scale to the LGA's level. So far, a few LGAs from 4 regions, the data you find therein are coming from the pilot LGAs from 4 regions. Thank you.
Okay. Thank you. That actually answers another one of the questions which had come up, which asked about whether there are other kinds of workers already covered under it, but you've said that it's sort of an initial system which is focusing on the parasocial workers. Another question, this one very specific. What is there an ID number system, and what is it? And if a worker moves within a district or out of a district, what happens to that ID number? So could one of you take that one too? It's about the existence and how the ID number system works.
I think I can jump into it if I leave anything my colleagues can add on. In terms of parasocial worker per se, these are not in the mainstream public sector who have special ID numbers called personnel files. But as earlier stated, the plan is to ensure that the system covers beyond the mainstream public sector through the social welfare officers and assistants. These definitely have ID numbers, and these ID numbers do not change for the public staff. Thank you.
Okay, thank you very much. Go on to a different question, and it's one about the application of the data. First, it comes from Alexander Zuber, and it said, "This is great. Congratulations on the progress. Have you been able yet to see changes in either workforce development or allocation as a result of the tool, or with the distribution of training?" So let's focus on that part of the question first. It's really more of an application or an impact question. Have you been able to see changes in workforce development or planning or allocation as a result of using the tool and the data?
I think one of the experts from the ministry will take on that.
Okay, through this system we were able to track where these parasocial workers, and we used the tool as the one to advocate for them to improve their career. So we regard the parasocial workers as a career path to where these parasocial workers can take advanced professional training. For example, currently we are having about 70 parasocial workers who have already been enrolled into the social welfare assistant. So without knowing where are they, what are they doing, it has been not possible to track them. So through this system we were able to trace them and advise them to apply for the higher trainings. So we thought that this system is very useful for improving the career path of the parasocial workers and the other developments within the social welfare workforce.
Okay. That was a good example of how it connects the tracking to providing some advice around training opportunities and career progression. And another person had a similar kind of question around just capturing professional development and ongoing training. Another question, have you considered analyzing the data with respect to other health services data? Or what are your thoughts about moving forward on this?
Well, as earlier noted, the system is still at the infancy stage, and the focus has been on data collection. The next step is where we are planning to go is to make sure that we have the skills to analyze the data and apply them to inform related decisions.
Okay, good. Let me then, yes, that was very helpful. And we have, I'm going to make a, go ahead.
Yeah.
Did somebody
Let's hear from Norah.
something? Okay, go ahead.
Yeah.
Yeah, in addition to that,
The system has been focusing on tracking parasocial workers with regard to services, etc. But also in the future, the system is aiming to capture all the social welfare officers, including the district social welfare officers and even the regional social welfare officers in a big picture. That means it will not end up in focusing only parasocial workers at the grassroots level, rather will cover at the national level. Thank you.
Okay. What I'm going to do now is make a transition. I noticed in the chat box and this is typical of what happens during a webinar, is there are some questions that are being raised, and some of you are going ahead and answering it in the chat box, which is a good idea. And I noticed that Norah has asked a question about from the Tanzania group. And so as we move on, if you see some questions there, you should feel free, anyone from the Tanzania group, to go ahead and comment on those or within the chat room. So having said that, I was just going to ask one more question that was of a technical nature around the software, Dykki, and I'll hand this over to you, and you can address the question, and then go ahead and introduce the Malawi one. And it was from Elaine Baker, who said, can other software and apps plug in, for example, using the RESTful approach, REST-ful approach? So, Dykki, why don't you comment on that, and then go ahead and introduce the Malawi team.
Certainly, I'd be happy to. The interoperability of the system is so very important to be able to allow different objects to plug in. The RESTful approaches are supported, as well as other technical approaches to facilitating that interoperability. Certainly any system that operates as a silo is not going to be useful to the other types of systems that plug in. The only other thing I might add is there were a couple of questions that I think were perhaps more relevant to the local government HRIS system. And this parasocial welfare system was a specialized aspect that was designed specifically to strengthen the Department of Social Welfare to support those technologies. And again, I'm speaking to what my understanding of it, that it was done as a specialized tool to really focus on the needs of the Department of Social Welfare and the social services workforce, while the larger local government HRIS covered all public sector workers. Okay, so with that, and please, team, add anything more into the chat box if you have other thoughts or comments. Lungo and Sif, I think that you may have some additional thoughts about the interoperability of the systems there in Tanzania. Meanwhile, I'm going to go ahead and introduce the Malawi team. And speaking with us today is Benjamin Kayala. He's a principal economist with the Ministry of Gender, Children, and Social Welfare in Malawi. In this role, his main responsibilities include facilitating the establishment of sectoral economic and social data banks, designing, developing, and reviewing monitoring and evaluation frameworks and systems for projects and programs, and monitoring and evaluating development policies, projects, and programs. He holds a Master's of Arts in Economic Policy Management from the University of Zambia. Joining him is Dr. Norah Nyarongo, HRIS consultant with IntraHealth International and the CapacityPlus project. Dr. Nyarongo has over 15 years experience in teaching and training and adult learning methodologies, e-learning, and community mobilization. This experience was obtained through working with government, parastatal, and other NGOs. Her specialties include early childhood development, systems strengthening, OVC coordination, curriculum and instruction. Dr. Nyarongo has a PhD from Virginia Polytechnic Institute and State University. She is fluent in English, Chichewa, Malawi's national language, and Chitumbuka, a prominent language in Malawi. She's currently working as a lecturer in educational psychology at Chancellor College, a constituent college of the University of Malawi. Her research interests are in electronic media, instructional design, curriculum development, and girls' education. And so with that, I'd like to turn this over to Benjamin and Norah. Thank you. Hello, Norah and Benjamin, can you hear me? You may again want to turn on your mic, the green mic in the upper left-hand corner.
Can you hear?
Yes, I think we did hear you.
Hello?
Is that Benjamin?
You can hear me?
Yes, we hear you well.
Hello? You can hear me now?
Yes, very well.
You're very clear.
Okay, thank you very much. Good morning, everybody. I'm Benjamin Kayala. I work for the Ministry of Gender, Children and Social Affairs as a principal economist. I'll be presenting on the Human Resource Information System project. I'll take you through the process, progress, and the challenges. First is the background. Why has the ministry embarked on this project? The ministry has actually prioritized this project because it's very relevant. The main idea is human resource planning. Through the system, the ministry will be able to generate reports, and these reports actually will assist in having correct numbers of staff, necessary skills. So actually that goes to training and development and even improving standards, that is performance standards. And regulation. Regulation is coming in because there are a number of players in the field of social work, and also there are a number of training institutions training social workers. Concept and scope of the project. The project is based on the initiative of strengthening the social welfare workforce, and in this reference, the original focus of the project was only on the social workers. However, upon discussions, the ministry management decided that this is an opportunity that the project should encompass all the HR cadres of the ministry. Therefore, it was decided that the project should include all the HR cadres. Therefore, as it stands now, the project actually includes all the HR cadre that is at the headquarters, institutions, districts, as well as community levels. Because as a ministry, we even have staff at the community level. Implementation structures of the project. The project has got two major structures. The first structure is the senior leadership group. The senior leadership group is composed of the ministry management. The ministry management includes the principal secretary, directors, deputy directors, and heads of the sections. And the major role of the senior leadership group is to provide strategic direction for the management of the project. The second structure is the technical team. The technical team is represented by officers from various departments of the ministry. The ministry has got 8 departments, and 6 are for technical services and 2 are for support services. The technical team coordinates overall implementation, that is assessing the needs, requirements, and even customizing the system to ensure that it conforms to the needs of the ministry. The technical team is also entrusted with the responsibility of building capacity of the district staff to ensure that they have necessary skills on how to manage the system. I will now take you through the progress which has been made so far. This is based on the roadmap which was developed. First is the planning workshop. A planning workshop was done to determine the key components of the system, and then determine the policy and management questions, the data to be collected, and then the report which the ministry would wish to be generating from the system. It is important to mention that the policy and management questions form the basis of this system. For instance, we have questions like, what are the current qualifications of staff? How many staff have been recruited? And a number of questions relating to staff deployment as well as attrition. So these questions actually are very relevant, and actually it informs the ministry in how it can program its activities to ensure that the performance is improved. Second, on the roadmap is the user and institutional assessment. This was done. We have 2 districts and 2 institutions in the pilot phase, that's including the headquarters. The main idea in the assessment was to identify the gaps in terms of the required infrastructure, because these pilot sites will require adequate infrastructure. So we aimed at identifying what actually is required in terms of the hardware, software, and the assessment went as far as trying to identify the gaps in terms of the skills, because the staff will actually be involved in managing the system. So we had actually to assess whether the members of staff at that level, that at the district level, are able to have the skills actually to manage the system. Capacity building for the key personnel for the project. Suffice to mention that we had 4 officers from the ministry who attended the training in Tanzania. This training actually provided a lot of skills to these 4 officers. To mention that these 4 officers were drawn from the technical team. I mentioned that we have 2 structures, the senior leadership group and the technical team. So this was these officers were drawn from the technical team, and the skills I've gained from this training actually is very, very important for us as a ministry. We are taking this as one way of sustaining the system building. The skills obtained actually will be able to be used so that the system is sustained. Procurement of equipment. The equipment for this pilot phase actually has been finalized, and for the headquarters, the equipment has been delivered. And what is remaining now actually is to deliver the equipment for the pilot sites. And the ministry actually will deliver the equipment very soon. Setting of the server. The server actually has been configured. We had technical support from the University of Dar es Salaam, and together with our IT section in the ministry, the server is now up and running. Training of data entry team. This training was done. It targeted the human resource staff and the clerical officers, and the training also targeted some key members of staff from the various departments of the ministry. Actually, we involved a number of staff to ensure that sustainability, because if, for instance, some of the staff might be transferred to other ministries, or they might leave the ministry for other reasons, we still have staff who can be able to manage the system. And it's pleasing to note that data entry actually is now at an advanced stage. We are working hard as the ministry to ensure that we clear the data. Yeah, progress has been made, but yeah, there are some challenges. Mainly there are 3 major challenges. The first one is the need actually to finalize customization of the system. The ministry would like to see more from the system. would like to see some analysis in terms of, for instance, the vacancy rate, analysis in terms of by regions, by district. So, I mean, this is not yet finalized because eventually, if the raw data is just entered to the system without proper analysis, it means in reference to our policy questions, it means I think we will not be able to achieve, I think, our intention as a minister. So that process actually needs to be finalized. And then the other major challenge is the internet connectivity. The ministry relies on the GWAN. GWAN is a government-wide area network, and more often the internet connectivity is very poor. So, being a web-based system, so this actually affects data entry. The other challenge is attrition. I mentioned that there are 4 officers who attended the training in Tanzania, and 2 of those officers actually have been, one actually has resigned from the ministry. He was the chief economist, has resigned, has joined another organization, and then the other one from the human resource section has been posted away. So actually this has affected in terms of continuity. So that actually has also actually had a great impact on the project. In terms of the next steps, first is to finalize customization. As I mentioned, the ministry actually would like to see a lot from the system in terms of analysis in reference to the policy questions, because we'd like to use these two actually in informing policy. And the next step is to finalize data entry. I've mentioned that we have challenges in terms of internet connectivity, but we expect that if internet connectivity improves, we'll be able actually to work. And we have actually discussed that staff members can even be coming during the weekends so that we clear the data which are available. The other step is to set up the system in the remaining pilot sites. It means there are now 4. Those are 2 institutions and 2 districts. And then we'll have to train the staff so that they have the necessary skills on how they can enter data into the system. And last but one, we'll be actually continuously reviewing the system to ensure that it addresses the needs of the ministry. To mention that we have agreed that we should be able to be having monthly reviews so that we can discuss in terms of the challenges and then how best actually we can modify the system so that the purpose of the system in terms of informing policy is achieved. Actually, we'll be using the technical team, then plus some other members of staff from the various departments of the ministry. And lastly, will be to roll out the project. Actually, the project will be covering all the districts in Malawi. There are about 29 districts. So after the pilot, the project will be rolled out. This is the end of the presentation. Thank you very much for listening.
And thank you very much, Norah. That was very, very helpful and a very good description of the kind of work you've been doing over the past year, relatively recent in getting the system up and running. We'll go into the question period now for Malawi and take about 10 minutes for that, and then maybe open it up after that for any other overall questions. So we can start with the question that was just put into the chat box, and go ahead, and if you have questions, you can put them into the chat box. What indicators are you using for system performance and for overall usefulness of the system? You didn't mention indicators at this point, and it may be relatively early, but you may have those, or you may have some views on this. So again, the question is, what indicators are you using for system performance and for overall usefulness of the system? I'll mute my mic and go ahead and answer that.
Okay, thank you very much. I mentioned about the policy and the management questions, and the indicators actually are related to the policy and management questions. In other words, I mentioned about one of the questions is what are the current qualifications of staff. So in other words, in terms of indicators, we're looking at the bachelor's degree, number of we're looking at number of staff with relevant qualifications. That is, we are looking at bachelor's degree and above. To mention that the ministry at the district level and up to community level, most of the staff actually they don't have bachelor's degrees. Some of them have got certificates in social work. Others have got diplomas. So we are looking at number of staff with required qualifications, so that eventually we are looking at we expect that members of staff who have relevant qualifications, they'll be able actually to assist in terms of delivering performance, required performance. And also in terms of, I mentioned about training, that's training and development. We are also looking at, because eventually if members of staff, they don't have the required qualifications, we are supposed to have like a training plan, so that these officers can be upgraded to higher levels. So we are looking at a number of staff who have upgraded, that is to the required qualifications. So eventually, if we have the training plan, actually the training plan from the system, that will assist us to have a training plan, and we'll be able to track from the training plan in terms of the numbers of staff the ministry actually is able actually to train. And so that's just, I think, an example of the type of indicators actually will be looking at.
Okay, thank you, Benjamin. That was helpful. So basically tracking the number of staff with relevant qualifications and aiming eventually for people with a BA, and then a training plan for the number of staff who have upgraded are a couple of examples of indicators, program indicators. Another question comes from Bakari. I'm interested in staff turnover challenge in the Malawi, the Ministry of Health. Where do they go to private or other public sector departments? So it's a question about staff turnover. Where do they go, public or private sector departments? So go ahead with that one, Benjamin.
Okay, thank you very much. That is, I think, staff turnover is a really big challenge. Of course, I think here is specific, that's Ministry of Health. The private sector, I think some of the members of staff, after they resign from government, from Ministry of Health, they go to the private institutions, also doing health care. But either they go as far as the UK. Actually, we have a number of members of staff who have resigned and then they have gone overseas, UK, United States, and these other countries. But within the country, actually, we have a number of private institutions, hospitals. So if they do the cost-benefit analysis, and then eventually, I think they move out. Also, to mention that the health sector actually do not have required numbers of staff. So if few of them leave the sector, actually it becomes really a very big challenge. So yeah, there is this public sector, they go to the private sector, that's these private hospitals, and others go overseas for greener pastures when they do their thorough cost-benefit analysis.
Okay, thank you. And in fact, I'm going to pick up on one of your challenges that you had on your challenge slide, Benjamin, around attrition of key members of the technical team. Because we were talking about kind of attrition in general, or people moving from one place to another. And I think you said there were 2 of the 4 people that had gone to the iHRIS Academy had left for other opportunities. How, what ideas, or how do you handle something like that? Because this is not an issue just for Malawi, but that kind of attrition of key members is an issue. So have you figured out how to address that yet? If so, what actions were you taking? Any comments on that, either Benjamin or anybody else from the Malawi team? Did we lose Benjamin? Are you still there?
Benjamin, Norah, either?
Either one?
I don't see them on the, I don't see any of the country.
Oh, that's true.
Participants. Yeah, I don't see either Norah or Benjamin on any longer.
Okay. Other people got kicked off too. Dykki, the attrition issue, you may not, there was a software question in here too. And you may or may not, I was just thinking if you could comment on that while we wait. There was questions about rolling out the system at local levels all over the country. Where are you, what mechanisms are in place, and so on to ensure data quality. I don't know if you're close enough to it to take a crack at that. What do you think?
Sure. I'll speak a little bit on behalf of the team while we wait to see if they can come back on. And to address the attrition question, as Benjamin mentioned, the champion who had been really driving the activity had indeed left, and only left a few weeks ago. And so, of course, that's always the concern. But what we've seen is that thanks to the relatively large delegation that came to the iHRIS Academy, there were enough other people who were able to pick up and continue the leadership inside of the ministry. And that's in addition to Benjamin, who did not attend the iHRIS Academy, but himself had already been stepping in from time to time to help co-chair some of the meetings and had been engaged enough to even step forward and present the work to this group here. So it's interesting to see the resilience that's taking place at the ministry to ensure that the work doesn't flag due to the stepping out of a key individual. So taking these steps to ensure you have multiple people who are engaged and can take responsibility, and even having perhaps a replacement plan to ensure sustainability if key members or key champions leave, is probably a good idea to be proactive in ensuring resilience of that kind of engagement. So that's speaking to the stakeholder issue. I'm just checking to see if they're back on, not quite yet. Speaking to the computer rollout issue, Malawi is one of those countries that's on the cusp of having strong enough local connectivity. And where there had been an original plan to have local servers and to be rolling out to the different institutions and districts, the team is now moving towards a centralized web-based system and is going to be building and training the capacity. Right now, it's less of an issue of pushing the system out to the districts as it is having the right roles, having the right decisions or right actions being taken at the district level. Currently, the social service the ministry does not have in their district offices HR staff who take and make significant HR decisions. All of those decisions are referred back to the central level. So until the processes change, there's a bit of an interesting chicken and egg here. Until the processes change, so more decisions are made in the district level, then there's not a whole lot of sense in rolling out the system to those districts, except for entering and sharing data a little more efficiently than is currently done. But when you don't have such a system, it can be difficult to decentralize that kind of decision making. So what the ministry has decided to do is to advance the system going to the local level and training people to work with that system, but in advance and to pave the way for that kind of local HR decision making to help decentralize that and better support the local districts. Does that help answer the question? Has the team rejoined? Ah, Norah,
it does indeed. Thank you.
Norah's back. I don't know if she could step in and add to anything I just said, if she heard it. Norah, are you there? Can you hear us? Or can you speak? I'm not sure that she's got her microphone working.
Yeah, and she can add.
Yes,
oh, there she is. Good.
Yeah, I can hear you, Dick.
Go ahead, Norah. We were talking a little bit.
I can hear you quite well.
Departure.
Yeah,
Great.
but I think we were
talking just a little bit about of Henry.
Yes. Yes,
okay.
Yes.
Let me ask you the question. We're talking a little bit about the departure of Henry.
The system is still loading, so I can hear you in parts, but not
the system. And we're also talking about the plans to have local districts.
Hello.
Okay.
I might suggest, given the difficulty with the actual
I'm still having
voice
problems.
communication,
I'm hearing part of what you're saying, but not all of it.
Further
So
remarks
you are
that
saying
maybe you
that
could type in the chat window there.
Hi, Dick.
Dykki has given an overview of that.
Chris, now I can hear you
why don't you
quite
try
well.
responding
Is
in the chat
this Jim
window?
speaking or Chris? I didn't get the whole of the question, so maybe if you can just repeat it. Now I can hear you quite clearly.
This is Jim right now.
What was the question?
And I can hear you well. Well,
yes, what was the question? I didn't hear the question.
I think the question was more on the kind of replacement of the difficulty with when you there must be a delay, right? I don't question. Well, we had two questions, and I think maybe what we need to do is to kind of move forward with it. The question that Dykki just finished answering was some observations about trying to replace some of the technical team members that originally went to the iHRIS Academy. I mean, how that helped, and he talked about having in the future for other countries that are interested, having a replacement plan for key technical people. So, and Dykki has just put the question in the chat window. So let me just suggest, it is around 10 o'clock and we're supposed to be drawing to a close. So my suggestion, Norah, is maybe you could type any further thoughts on this there. And what I'm going to do is go ahead and move us forward, and just to say, are there, given the shortness of time, are there any overall either observations from the Tanzania team or from Malawi or from Dykki, or any final questions?
I might step in just for a little bit. I think Norah might be typing some responses within the chat window. And I would say that some of the key lessons learned, and this might be getting a little bit into my closing remarks, but we can keep those rather short, is we saw that the parasocial welfare system was in some ways driven at the program level and by a project that was seeking to support that cadre. And the engagement of the Department of Social Welfare, of the stakeholders, came at a later stage in the process. In contrast, the Malawi team from the beginning was really driven by the interest of the ministry to have a system that would work. And there's been very interesting emphasis on having the ministry in the lead, including wanting to go and work on it independently of external support, of really defining and making sure it was a system that was owned locally. And where I've seen today some great uptake of the system in Tanzania by the stakeholders, to see that stakeholder-driven component, while things may have moved a little slower to get things started in Malawi, it seems to be going more substantially and farther and in a more sustainable way, even to the point of being resilient in the departure of a key ministry champion. Might be one lesson learned.
Thank you, Dykki. Actually, I think what we will do is go ahead and use that as a segue into your closing remarks and any further overall comments, and then we'll close out. So I'll give it back to you, Dykki.
Okay. Great. I was seeing that Bakari is back here and online. I didn't know if anyone of the Tanzania team had any final statements. My own closing remarks are essentially that. We've seen two different contrasts and two very nascent and emerging systems. There's been a great deal of investment. I think this follows the curve of investment in the health workforce and investment that countries and donors are now making in the social service workforce. The health workforce challenges were really identified in the World Health Report of 2006 and the joint learning initiatives supported by Rockefeller that informed it around the challenges of the health workforce. And donor investment and country attention subsequently followed that, with a great deal of effort at understanding and developing systems to support the health workforce. We've now, in the last couple of years, seen a commensurate investment and attention being paid to the social service workforce, focusing on the health of communities. So we're now seeing attention being given to supporting countries, stakeholders, departments, and ministries of social services to have better systems, to have the same level of understanding of the social service workforce, and to address challenges in supporting them and deploying them to where services are most needed. And so we're seeing these adaptations, which I think are wonderful, instead of starting from scratch, building on where health workforce information systems have already gone, but also taking them to new levels and addressing new challenges. I've had conversations recently that where in many cases health tends to focus on facility level services and information systems, the social service systems are really focused on the individual social workers at the community level. And where social services have been taking this approach for a very long time, we're now seeing health, in an effort to achieve universal health care, beginning to more greatly leverage community level health workers in providing those services. So there's an opportunity for natural synergy between the health sector and the social services sector to take this individual service-driven approach and be able to reapply it into the systems, as both seek to greater serve the most rural and remote communities all over the world. So with some of those thoughts in summary, and welcoming and appreciating and thanking those presenters of the countries who really are on the leading edge of social service workforce information systems, I would like to turn this over to Amy Bess for some final comments and to wrap things up.
Great. Thank you, Dykki, for moderating this session, and to all of our exceptional presenters today. Also to Jim for moderating the Q&A. And also there are a lot of behind-the-scenes people who work on these webinars, from Jeff and Chris and Stephanie in our IT division, and Alex Collins and Dana Singleton, who also help out with these webinars quite a bit. So thank you, everyone. It's such an extensive process getting these systems set up, but iHRIS is so critical to solid workforce planning and developing. So thank you everyone for joining us today. I'm just going to make a few brief announcements and also invite you to announce any upcoming events. One upcoming event that the Alliance is hosting is a symposium on strengthening families and building strong futures for children. We'll be featuring the role of the social service workforce. This event will take place on April 29th here in DC at the National Press Club, but we'll also be live streaming it so that anyone from anywhere in the world will be able to join in as well. We will be posting more information soon on the Alliance website, socialserviceworkforce.org. So again, thank you. If you have any other events or opportunities that you'd like to share with the other participants, please do type that information into the chat window. Also, if you are interested in joining the Alliance and receiving information about future webinars, you can go to the website, and the address is there, and join the Alliance or sign up for our mailing list. Also, I just want to remind everyone that, as always, we do post a summary of this webinar and a recording on the website, and that will be available in about a week and a half or so, 2 weeks. So in case you have colleagues or anyone you know of who missed this webinar and you'd like to invite them to listen to it, we'll be sending you the link to it in a few weeks. At this point, I'd just like to say again, thank you very much to everyone for joining us today. Thank you again to the presenters and to Dykki and Jim.